Hey everyone, welcome back to our channel where we discuss all things health and wellness. Today's topic is one that affects millions of people around the world: anxiety. Anxiety is a natural response to stress, but for some people it can become overwhelming and interfere with their daily lives. In this video, we will be discussing the top 10 signs of anxiety so you can better understand and recognize this condition. We will also provide tips and strategies for managing anxiety and improving your overall mental health. So whether you're experiencing anxiety yourself or know someone who is, this video is for you. Let's dive in. 1. Lack of fetal movement. Lack of fetal movement, also known as decreased fetal movement, is a cause for concern during pregnancy. Feeling your baby move is a reassuring sign of their growth and development, so if you notice a decrease in movement, it's important to contact your doctor immediately. While it's normal for fetal movements to fluctuate throughout the day, a significant decrease in movement can be a sign of a problem. There are several potential causes of decreased fetal movement, including fetal distress, placental problems, or a decrease in the amount of amniotic fluid. Other factors such as the position of the baby or the mother's activity level can also affect fetal movement. Your doctor may recommend further testing or monitoring, such as a non-stress test or ultrasound, to ensure the health and safety of the baby. Remember, if you notice any changes in fetal movement, it's always best to contact your healthcare provider to be safe. 2. Abnormal fetal heart rate. An abnormal fetal heart rate can be a cause for concern during pregnancy. A healthy fetus will have a heart rate that ranges between 120 and 160 beats per minute. If your doctor notices any irregularities in the heart rate during an ultrasound or checkup, they may recommend further monitoring or testing. There are several reasons why a fetal heart rate may be abnormal. It could be a sign of fetal distress, which may be caused by a lack of oxygen or other complications. In some cases, the mother's health may also play a role in the fetal heart rate. For example, if the mother has a fever or an infection, it can cause the fetal heart rate to increase. Your doctor may recommend additional testing or monitoring if an abnormal fetal heart rate is detected. This could include additional ultrasounds, fetal heart rate monitoring, or other tests to assess the health of the baby. It's important to remember that an abnormal fetal heart rate doesn't always indicate a problem with the baby's health. However, it's always best to err on the side of caution and report any concerns to your doctor immediately. Regular prenatal checkups and ultrasounds can help detect any potential complications early, which can improve the chances of a healthy pregnancy and delivery. 3. Abnormal growth. Abnormal growth during pregnancy can be a sign of a problem with the baby's development, and it's essential to monitor the size of your uterus and baby throughout pregnancy. If your baby is measuring too small or too large, it can indicate a complication such as gestational diabetes or a placental problem. When your healthcare provider measures your uterus, they are measuring from the top of your pubic bone to the top of your uterus to determine the size of your baby. An ultrasound can also be used to measure the size of your baby and check for any abnormalities. If your baby is measuring too small, it could be a sign of intrauterine growth restriction, IUGR, which means the baby is not growing at a normal rate. This could be due to a placental problem or poor maternal nutrition. If your baby is measuring too large, it could be a sign of gestational diabetes, a condition in which high blood sugar levels during pregnancy can cause the baby to grow larger than average. It's important to monitor abnormal growth during pregnancy and work with your healthcare provider to manage any complications that may arise. Your provider may recommend further testing or monitoring, and they will work with you to ensure the health of both you and your baby. 4. Excessive amniotic fluid. Polyhydramnios, or excessive amniotic fluid, occurs when there is an increased amount of fluid surrounding the fetus in the uterus. This condition can be caused by various factors, such as fetal abnormality, gestational diabetes, or twin-to-twin transfusion syndrome. In some cases, polyhydramnios can be a sign of a fetal abnormality, such as Down syndrome or a neural tube defect. Your healthcare provider may recommend further testing or monitoring to determine the cause of the excess fluid and ensure the health of both the mother and baby. 5. Too little amniotic fluid. Oligohydramnios is a condition in which the volume of amniotic fluid surrounding the fetus is abnormally low. This can be caused by a number of factors, including problems with the baby's kidneys or urinary tract. The amniotic fluid plays a crucial role in the development of the fetus, providing protection, nutrition, and aiding in the growth of the lungs, digestive system, and musculoskeletal system. When there is too little amniotic fluid, it can increase the risk of complications such as premature birth, fetal distress, and stillbirth. It's important to monitor amniotic fluid levels during pregnancy to ensure the health of the baby. 6. Abnormalities on ultrasound. An ultrasound is a vital tool in monitoring the development and health of a fetus during pregnancy. It can detect any abnormalities or complications, such as structural abnormalities, organ defects, or growth problems. If any abnormalities are detected, your doctor may recommend further testing or monitoring, such as a more detailed ultrasound or an amniocentesis. It's important to attend all scheduled ultrasound appointments and to follow your doctor's recommendations for additional testing or monitoring. Early detection of any abnormalities can lead to better outcomes for both the mother and baby. 7. Bleeding. Bleeding during pregnancy should never be ignored. Even if it's just light spotting, it's important to report it to your doctor right away. In some cases, bleeding can be a sign of a serious complication such as placenta previa, where the placenta partially or completely covers the cervix, or placental abruption, where the placenta separates from the uterine wall before delivery. Both of these conditions require immediate medical attention to ensure the health and safety of both the mother and baby. So don't hesitate to seek help if you experience any bleeding during pregnancy. 8. High blood pressure. High blood pressure is a common condition during pregnancy and can be a sign of preeclampsia, which is a serious complication that affects both the mother and baby. Preeclampsia can lead to premature birth, low birth weight, and even maternal and fetal death in severe cases. It's important to monitor blood pressure regularly during pregnancy to detect any potential issues early on. If you have high blood pressure during pregnancy, your healthcare provider may recommend medication or other interventions to manage it and prevent further complications. Don't hesitate to reach out to your doctor if you have any concerns about your blood pressure or other symptoms during pregnancy. 9. Low weight gain. During pregnancy, it's crucial for the mother to gain weight to support the growing fetus. However, not gaining enough weight can be a red flag for a potential problem with the baby's growth or development. This can be due to issues such as poor nutrition, hormonal imbalances, or other medical conditions. If a mother isn't gaining enough weight during pregnancy, her healthcare provider may recommend additional testing or monitoring to ensure the baby is growing and developing properly. It's important to follow the healthcare provider's advice and maintain a healthy diet during pregnancy to support the baby's growth and development. 10. Premature labor. Premature labor, also known as preterm labor, is defined as the onset of labor before 37 weeks of pregnancy. It can be a sign of an unhealthy fetus or complications with the pregnancy, and it's important to take it seriously. Premature labor can lead to a variety of complications for both the baby and the mother, including respiratory distress syndrome, brain damage, and infection. If you experience any signs of premature labor, such as contractions, pelvic pressure, or lower back pain, it's important to contact your healthcare provider immediately. They may advise you to come in for an evaluation and may recommend treatments such as bed rest or medications to help stop or slow labor. It's also important to stay hydrated, avoid strenuous activity, and monitor your symptoms closely. Remember, the earlier premature labor is detected and treated, the better the outcomes for both mother and baby. In conclusion, monitoring your baby's health during pregnancy is crucial for a healthy outcome. The 10 signs of an unhealthy fetus or symptoms of an unhealthy baby during pregnancy can be concerning, but early detection and intervention can prevent potential complications. It's essential to communicate any changes or concerns with your healthcare provider and follow their advice. By taking care of yourself and your baby, you can help ensure a healthy pregnancy and delivery.